Good morning. Welcome to your training on the importance of effective communication in healthcare. We're going to take a little time today to discuss what effective communication in healthcare is, the impact it has on the organization, its patients and providers, along with the impact on society. We will also examine evidence-based solutions to improve communication in the healthcare setting. So let's get started. Effective communication is important in any aspect of life and can be defined as the sharing of concepts, feelings, perspectives, and the like among people to gain knowledge and understanding. In other words, to get a point across. Effective communication is vital in the realm of healthcare, and if it is lacking, the quality of care given would be compromised. There would be increased costs in organizational care and potential adverse patient outcomes. Effective communication is multi-layered, and you must have healthcare knowledge, social skills, and familiarity of language barriers, because without each layer, the communication becomes ineffective. And if there isn't a clear understanding of the message or the information being conveyed, the quality of care could be in jeopardy. Years ago, providers did not learn communication skills from a book, but learned them through trial and error when they were taking care of their patients, which did not always turn out well. The good thing is that now effective communication skills are being taught as part of the curriculum in their college and med school programs. Today, patients are inquiring more and more about their care and their treatment, so it is critical that all providers have effective communication skills. This has been shown to provide a much better standard of care, fewer medical errors, and better patient compliance. In addition, organizations that hold weekly huddles or brief meetings for staff give them an opportunity to communicate any issues and concerns they have, along with allowing time for education and reinforcement of successful practices or process improvements in the department. These huddles go a long way in enhancing teamwork, improving efficiency, and reducing the number of conflicts and misunderstandings in the organization as well. A Baylor University article stresses the importance of communication skills for providers when speaking to patients and/or their families. These skills go a long way in developing a rapport with the patient, along with showing empathy and caring. Providers that have a focus on communication with their patients will calm their fears, will be honest about diagnosis or concerns with their treatment, and will take into consideration any diversities they may have. Excellent communication skills will be advantageous to how it affects a patient overall, from their behavior to satisfaction, resulting in fewer medical errors, better patient compliance, and will decrease the likelihood of lawsuits. A study determined that improved teamwork and communication are described by healthcare workers as among the most important factors in improving clinical effectiveness and job satisfaction. So organizations that cultivate a team collaboration environment of members with an open mind, a positive attitude, and mutual trust and respect for each other will feel less stressed and are less likely to be affected by burnout. When we talk about the impact that an effective communication has on society, I go back to the previous slide when I discussed that excellent communication skills increase a patient's overall behavior and satisfaction, and ultimately their final outcome. People talk, and for every good experience a person has, An article on Forbes.com says that they will tell an average of 9 people. So this has the potential to increase trust in providers and will portray a positive image for the healthcare organization. But for every negative experience a patient has, they will tell an average of 16 people, which over time could have a detrimental effect on not only the providers, but on the image of the organization as a whole. Now let's talk about some evidence-based ideas and solutions for effective communication in healthcare. In an American Academy of Family Physicians article, William Cayley discussed the following excellent strategies. The first strategy is take a seat. This is where healthcare personnel take the time to sit down with their patient, to talk to them, and to really listen to them about what their concerns are regarding their diagnosis and treatment plan. This has been shown to significantly improve the patient satisfaction level because the patient feels like their anxieties and their fears matter and that they were addressed. The second method is expect there to be more. If you use this strategy, you must always assume the patient will have more questions or more concerns than just the current illness or issue at hand. This method involves the use of different adjectives and phrases to help the patient in expressing what they want or need. An example would be to use the word some instead of the word any. So, ask the patient if there is something else to address instead of asking the patient if there is anything else to address. The change of adjective makes the patient feel more comfortable in addressing other issues, like their options are open to talk about more than the present problem. The third evidence-based strategy is the BATHE technique. BATHE stands for background, affect, trouble, handling, and empathy. The author recommends this strategy be used by a provider during a patient encounter to be certain that they are getting a broader view of what a patient is dealing with in their life. In a study using this method, it revealed that those patients who received the technique stated that they were more satisfied with their treatment as opposed to those who did not receive the technique. The fourth method is reassurance. This is the last of the evidence-based communication strategies in the article. A healthcare provider who takes the time to deliver and explain information to their patients about their diagnosis and their treatment of their condition, including other things to consider or be aware of, or when to call the office, will likely enhance patient trust and compliance with the provider and the treatment plan. Studies show that when it is a physician instead of another member of the healthcare team who presents the material and the education, compliance and satisfaction are markedly better. What it comes down to is that patients want a connection with their provider that includes compassion and autonomy in their diagnosis and treatment choices. So the use of one or more of these approaches will create a positive relationship between the provider and the patient, resulting in better patient outcomes. Now, an evidence-based tool for use in effective communication amongst healthcare personnel is SBAR. The S stands for the situation or the reason why we have a patient in for care. The B is for background, that includes the relevant information and history of the patient being handed off. A is for assessment or the current condition of the patient. And the R is for recommendation or the things that need to be accomplished with the patient by the employee taking over after the handoff. This is a perfect way to keep things patient-centered and ensure that no information on a patient was missed between coworkers during the handoff. Now, SBAR is also a great tool to use in the case of conflict management in a facility, as it will assist in breaking down the conflict into parts so that nothing is missed and a resolution is found. Well, here we are. We're at the end. Effective communication in healthcare is vital not only to the organization, but to patients, providers, and the community. Effectively communicating in healthcare ensures the delivery of the best quality care to patients, resulting in more positive patient outcomes, fewer medical errors, better patient compliance, and a higher patient satisfaction rate, which in turn improves trust in the providers and the organization alike. In addition, effective communication will improve employee satisfaction, teamwork, and efficiency within the organization. And finally, using evidence-based solutions to train employees will provide them with the effective communication skill set that is vital in the overall success of the organization. Thank you for watching, and have an awesome day.